Good morning, I'm Mabel Jong and I'm in the World Healthcare Congress interview zone, and joining me is Gary Ahlquist, who is with a newly formed entity called Strategy And. Now Strategy And, Gary, it's very exciting. It's all come together. Your combination, Booz and company with PwC.
Yes.
How will life change generally? They're completely different in size and scope.
Completely different in size, somewhat different in our emphasis, but then therein lies the beauty of the combination in our view. We're very complementary in what we do. Booz and Company has traditionally been a strategy house working with the C-suite, senior executives and boards. PwC's consulting advisory business has traditionally worked at that level, but more with implementation and execution to get results. And so together we're feeling as though we're bringing the boardroom down to execution so that we can deliver strategy and results together on a global basis. And in our view, it's really the first such combination that's out there in the market today.
Absolutely. I mean, so many resources available to all of you at this combined company.
True, yes. We've done some research in advance of this, and perhaps not surprising, the agendas globally are accelerating. There's more uncertainty, more complexity in the environment. And when you talk to CEOs, what you hear is somewhere over a third of them say they're not actually fully confident they've got the strategy right. Mm-hmm. And even a larger proportion of them say they don't believe they have the resources to execute. And so this combination of PwC and Booz and Company, or Strategy And, is aimed directly at those two issues, to get the right strategy and to deliver the capabilities so that they get results faster with less risk and less uncertainty.
On the healthcare front, what are some of the basic challenges you're tackling still? We've had reform in place for quite some time now. The public exchanges are now up and running. Rocky start, but I'm sure there was a lot to be learned from that experience. So what are you doing on the ground with your clients?
It depends on which segment we're talking about. As we know in the delivery system side, their agenda is huge. They've been inundated with initiatives. They need to reduce costs dramatically. They need to prepare themselves to take on risk, which means they really do need to get the entire enterprise integrated. They're trying to decide now, more of late, about this question of should we become an insurance company too? Should we try to become Kaiser Permanente or something approaching it so that we can deliver the full spectrum? The health insurers on the other side have a huge legacy business that they've been pursuing, employer-based, and of course with exchanges, public, private exchanges, more defined contribution health plans, their business mix is changing dramatically as well. I would say at this point the two haven't yet met up in a middle ground, but there's an awful lot of discussion about should we be doing more to collaborate together to have a better future rather than seeing it from our two different lenses.
When I hear collaborate, I'm also thinking consolidation.
True.
Are we going to be seeing a lot more of that going forward?
Well, we've said, and I think we said about a year ago in our own research, we expect to see 1,000 hospitals change ownership in the next 5 to 7 years. And so far that's playing out. Maybe we understated it, which would be a first for a consultant's projection. That's driven by the need to get costs down. That's driven by the need to assume risk. In the risk-bearing world, size does matter. And so we expect that trend to continue. The payer side together, the collaboration side, started off dating. There was an awful lot of positive discussion and bouquets of flowers being handed back and forth. That seems to have cooled down a bit as both sides try to discern what's the right path for them. But I do think we're seeing more discussion now about how do we get after this fundamental issue of treating consumers individually with data and analytics to reduce medical costs so that we get this whole issue of the health spend under control once and for all.
There are a number of systems just here at this Congress who do it all.
Yes.
and from end to end, from financing to delivering care. How practical an option is that for smaller systems?
It's not. It is very difficult because, of course, assembling those capabilities and the required investments in people and technology and process is almost a daunting task if you're a smaller institution. Hence, one of the reasons we see more consolidation on the delivery system side, saying, we can't afford it, you've already built it or built most of it. Is it a good fit for us in our market, our culture, and so on, to join a system that already has those capabilities? So 10 or 20 years ago, we used to think about this on supply chain, reducing supply costs to get a bigger spend. It's a completely different ball game now.
Absolutely. What is your life like day to day, Gary? I mean, what sort of issues are you tackling with your clients?
Well, on the delivery system side, one of the bigger trends, which has been perhaps under the radar screen, is this whole notion of bundles, healthcare bundles. It started out being called health payment, bundle payment, but we now see it as a much more fulsome construct about bundling the delivery of care, integrating the physicians around that bundle, thinking about how to price it and how it should be paid for in the market, almost as an individual product, if you will. You were talking about smaller systems. Another notion is there are many systems which have assembled physicians and electronic records, but they haven't integrated it. It's a very hard thing to do. And we're finding that these bundles are a way to break the problem into smaller pieces and to learn how to deliver lower cost care in an at-risk environment for a set of procedures and continue to build that out and then become that risk-bearing enterprise fully, which is a sort of an alternative to an ACO approach, which is a bit of a top-down gain-sharing approach. And so, is there any one perfect path? No, but there are different paths that we're now finding, which I think is helpful for the delivery system and the payers to realize that there's more than one way to skin this cat.
You carry years of experience in this area, Gary. Even your colleagues at Strategy and just speak with you with such respect. What is it that you think is missing? Any type of business opportunity that you think that makes sense, that is coming down the line?
Well, for 25 or 30 of my years in this profession, I have long and we have believed at Booz & Company that the one party that is left out of this or not important enough in the equation is the consumer. You and me, my parents, your parents, the people who are out in the system experiencing this every day. And we have long believed, and many of what is happening now is headed in that direction. It's a good thing that we put the consumer in the middle of this system, figure out what is right for him or her. And I believe most of the other big issues will actually take care of themselves if we do it that way.
They are not only in the middle, but aren't they leading this in a way?
They are leading this, and the more we put the decision-making onus and or rights on them, as they do in any industry, I would expect them to raise their voices, and we will need to listen to say, how do we best serve you? Because as we move more risk into their decision making, there's a whole set of consumers who will make a decision based on price, as they do in many things. Others will make it based on service or quality. That is a good way, I think, for decision making to occur. We need to therefore arm them with the tools, which is happening. There are a lot of players at this conference who are developing these tools and methods and approaches, applications on phones and so on. That is a really good thing. It's messy, it's frothy right now, but I think it's leading to a better future for the system.
Okay, Gary Ahlquist, thank you for your time today.
Thank you, Mabel.
And I'm Mabel Zhang. Thanks for watching.